Wish TV's Focus on Food is a commitment to improving food accessibility in the community. Hear from expert culinary contributors, health professionals, and people who are making a difference in the fight to eradicate hunger. Made possible by Indiana University Health.
On a mission to save infant lives and improve health outcomes, the Milk Bank provides access to safe human milk. Here to tell us more about this important work at the Milk Bank are Freedom Kolb and Sarah Long. Welcome. So glad to have you.
We're thrilled to be here.
So there's a real push to breastfeed and for human milk. Tell us why that's so important for the health outcomes of infants.
Absolutely.
Yeah, so human milk is unique. It's species specific. It's biologically designed to support humans and human babies. It's not just nutrition, it really affords protective elements for lots and lots of different diseases and infections that many newborns may face. So it's much more than nutrition. It really is that focus on medicine, and particularly for those very fragile infants.
So Sarah, I know that there are viewers who are probably saying, well, how is that different from a formula, because there are vitamins and minerals that are put in formulas. Mm-hmm. So why is it so much better? What makes it different?
Again, because it is unique and uniquely designed for human babies. There's naturally occurring properties. It's the perfect combination of nutrition at every stage and those protective factors that really are unparalleled. And of course, you know, formula is nutrition. However, it doesn't have the benefits that naturally occur in human milk.
So infant mortality rates are very high. I know in Indiana, at least we've been in the top 5 for a long time. Does human milk help with those infant mortality rates more than maybe formulas?
Absolutely, you're exactly right. So Indiana is typically among the top 10 worst states in the country in terms of the number of infants we lose. And what that really means for us as a community is we're losing about 11 babies a week.
Wow.
In the last 5 years, that's about 2,700 infants and the devastating impact that has. Now, the bright spot is a lot of our public health leaders are zeroing in on how we can help families and help increase our survival and thriving rates. But one of the ways we know to do that, the bright spot, is breastfeeding and human milk. And when it comes to donor milk through the Milk Bank, is in some cases we can increase survival rates for specific diagnoses like necrotizing enterocolitis 77%.
Wow.
So it can be the difference, especially those born too small, too sick, or too soon, in getting to come home and celebrate that first birthday with their family.
So let's delve into the impact a little bit more. How many babies are you actually serving?
Yes, so this is our 20th birthday for the Milk Bank. And
wow.
In that time, we've delivered an estimated 15 million feedings. So when you look at that across the community, what that means for us is we need more than 1,000 milk donors to step forward every year, because almost 90 hospitals all across the state of Indiana and around the Midwest rely on us.
So how does the Milk Bank work? How do you know the milk that you're getting is safe? And who should come in to give milk?
Yes, so for the most part, we have milk donors come to us. They're healthy lactating mothers who may have excess milk, and they go through a process that we support them through all along the way. They're doing a fantastic job for us. So whilst we have to focus on safety, we hopefully make that experience as a journey that they can remember as a legacy. And so we walk them through the process. Of course, there's safety steps and standards we must follow. We take care of that part for the moms, and hopefully they have a great experience. And then once our milk donors are approved, we then go through a process internally at our lab where we safely process and ensure that that milk is safe for the most fragile babies. Those are extra steps that we must do. We follow national standards, and all milk that leaves our building is approved milk.
Great. That's so wonderful, the work that you're doing, and hopefully mothers that need milk will come in. Thank you.
Thank you.
This is the Wish TV Focus on Food podcast, made possible by Indiana University Health. Find more on the Focus on Food website by visiting wishtv.com/food and watch the ongoing coverage on Wish TV.